Hey everyone, welcome back. Let me ask you something. Have you checked your mail lately and found a letter from your health insurance company? If not yet, you probably will soon, and the news inside may not feel great. Millions of people are about to see some of the steepest health insurance cost increases in more than a decade, and the timing couldn't be worse. Some experts are saying premiums could jump by hundreds, even thousands of dollars depending on your plan. And what makes this even more pressing is that for many, the real shock is just starting to show up in those letters. So yeah, this is one of those moments where being informed early can really make a difference. Stay tuned, because today we're going to break down why costs are rising, who it's hitting the hardest, and what options you might actually have to protect yourself. Before we get into it, let me know in the comments, have you ever been surprised by a sudden increase in your insurance costs? Or maybe even a medical bill you were expecting? I'd love to hear your experience. And if you find this kind of clear breakdown helpful, make sure you subscribe so you don't miss future updates. Now, here's the thing. These increases didn't come out of nowhere. They're the result of years of cost pressures stacking up. For employer-based plans, which cover the majority of Americans, companies like Mercer and Aon are projecting around a 9 to 9.5% jump in 2026. To put that into perspective, the average cost for a family health plan is already around $25,500 a year. That's like buying a small car every single year just to stay covered. And for employers, especially small ones, it's becoming almost impossible to keep up. Some are raising deductibles, some are cutting coverage for certain medications, and some are even questioning whether they can continue offering insurance at all. But it's not just employers who are worried. If you get your coverage through the Affordable Care Act marketplace, things could get even rougher. You see, during the pandemic, temporary tax credits were introduced to make ACA plans more affordable, capping premium payments at 8.5% of income. Those credits have already been extended twice, but they're set to expire soon. And if Congress doesn't act, people could see their premiums jump by more than 75%. Imagine paying $500 a month today and then suddenly being told it'll be closer to $900 or more next year. That's the reality many families are bracing for. So then, why is all this happening now? Well, part of it comes down to inflation, which you've probably noticed at the grocery store or gas station. Healthcare isn't immune to those same rising costs. Hospitals, doctors, drug makers, they're all dealing with higher expenses, and those costs get passed down to insurance companies and then to us. Another big factor is the rise of new prescription drugs, especially the weight loss and diabetes medications like Wegovy or Zepbound. These are called GLP-1 drugs, and they've exploded in popularity. They're effective, but they can cost $800 a month or more, and insurance companies are struggling to absorb that. Usage of these drugs nearly doubled in 2023 and then grew another 56% in 2024. That kind of surge means insurers have to make tough decisions about whether to cover them, limit who qualifies, or cut them out altogether. Some big companies like Mutual of Omaha have already stopped covering them for weight loss because the cost became too high. And speaking of costs, there's also a new political layer here. The Trump administration has floated the idea of raising tariffs on imported pharmaceutical ingredients. Right now, about 30% of those ingredients come from China. If tariffs go up, drug prices could climb even more. United Healthcare has already warned about a 3.6% increase tied to this uncertainty. And rural hospitals are especially nervous because higher drug costs can be the difference between staying open and shutting down. You see, when we talk about insurance premiums rising, it's not just numbers on a page. It affects real people in very real ways. Think about small business owners trying to do right by their employees, but feeling sick to their stomach when they see a 20% increase in their group plan. Or families in Texas where 1 out of 3 residents has no insurance at all, now facing the possibility of losing subsidies that kept their premiums affordable. I read about a doctor whose own sister died at 45 from unmanaged diabetes and heart disease. For her, these rising costs aren't abstract. They're tied directly to life and death outcomes in her community. So what does this mean for you? If you're on employer coverage, it could mean higher deductibles, more out-of-pocket costs, or reduced benefits. If you're on the ACA marketplace, It could mean bracing for sticker shock unless Congress extends those subsidies again. And if you rely on certain prescriptions, especially newer ones, you may want to double check your coverage during open enrollment to avoid surprises. Now, the political fight around this is heating up. Democrats are drawing hard lines, saying they won't agree to a budget deal without extending subsidies. Some Republicans, especially from swing districts, are worried about families seeing premiums rise by thousands of dollars in an election year. Others are saying it's time to return to pre-pandemic policies and let those subsidies expire. And with the 2026 midterms on the horizon, this debate is only going to get louder. Another thing to consider is timing. Open enrollment starts in November, but those letters with your 2026 premiums are already arriving. If Congress waits until the last minute, it might be too late to stop the disruption for ACA participants. That's why you may want to review your plan options early, explore alternatives if available, and pay close attention to updates from your insurer. And also, there's a hidden consequence not everyone talks about. When coverage gets too expensive, some people simply drop it. That leaves fewer healthy people in the insurance pool, which drives premiums even higher for those who stay. It's a vicious cycle. Experts call it a death spiral. Now, some researchers say the original ACA subsidies will keep the system stable enough. But even then, hardship for individuals is very real. And besides the financial stress, there's also the human side. Workers who skip doctor visits because they can't afford the deductible. Seniors rationing medication. Parents worrying if their kids will still be covered. And rural hospitals facing overwhelming demand while struggling to pay for supplies. It's not an exaggeration to say this is a crisis of affordability that touches every corner of the country. So what can you do? First, don't ignore any letters from your insurer. Those notices include details about your new premiums and deadlines for making changes. Second, if you're eligible for subsidies, make sure you understand how much help you'll get and what happens if they expire. Third, compare plans carefully during open enrollment. Sometimes switching tiers or networks can save you money, but you'll want to balance cost with coverage. And if your employer is raising deductibles, ask HR if there are health savings accounts or wellness programs that could help offset some of the costs. And one more thing, don't be afraid to share your story. Lawmakers are paying attention to how these changes affect real families. Whether it's writing to your representative or even just commenting here, your voice adds to the bigger picture of what's really happening out there. Now, here's the part that might surprise you. Even with all these challenges, there are still safety nets in place. Medicaid continues to cover millions, and community health programs are stepping in where they can. But the reality is, the system is under enormous strain, and how Washington handles the next few months could shape healthcare costs for years. So yeah, health insurance costs are going up, and the letters arriving in your mailbox are proof of that. It's a tough situation, but staying informed, reviewing your options carefully, and taking small proactive steps can make a difference. And by talking about this openly, we can all be better prepared for what's coming. If you found this breakdown helpful, don't forget to hit subscribe. And I'd really love to hear from you in the comments. How are rising healthcare costs affecting your family or your community? Let's make this a space where people can share, support, and learn from each other. And remember, the more you know now, the better prepared you'll be later.